reporting. Now, South Africa's record on AIDS is dismal. In fact, it's even worse than that. President Thabo Mbeki's denial of the link between HIV and AIDS, plus some of the bizarre supposed health initiatives associated with that denial, have resulted in the premature deaths of hundreds of thousands, according to research published this week. Our science editor Susan Watts reports on how South Africa, now with a new health minister in charge, plans to make amends.
For years, Thabo Mbeki denied that HIV causes AIDS, and as a result, victims of the disease were not given the powerful drugs they needed to fight the illness. Every week that he delayed, thousands died, while he championed the views of mavericks.
It's a very worrying thing that anybody can say today, in today's world, that there is a point of view that is prohibited, that's banned, that they're heretics who must be burnt at the stake. And it's all said in the name of science and health. Can't be right.
His health minister, Manto Shabalala-Mizimang, pretended the jury was still out.
It is opening everybody's mind because there are many questions that all of us have not answered.
This week, Harvard University put a figure on the number of people that died as a result of Mbeki's government's stance on HIV. Researchers attributed 330,000 deaths directly to South Africa's policies between the year 2000 and 2005. Lives that could have been saved if the government hadn't refused to give drugs from a developed world it viewed with suspicion and opted instead to promote traditional remedies. While President Mbeki was saying he couldn't afford AIDS drugs, he was negotiating arms deals worth billions of pounds. Allegations of corruption surfaced. The former ANC MP who blew the whistle over weapons was also alarmed by the leadership's denial of the link between HIV and AIDS and fears that view is still out there.
We're seeing new evidence that just gives a sense of how irrational the position is. We're also seeing hard facts of the numbers of South Africans who died unnecessarily as a consequence of President Mbeki's denialism. But unfortunately, it's not yet a done deal. Just this past week, we've seen a provincial health minister parroting the former minister, talking about garlic, olive oil, beetroot as possible remedies for HIV and AIDS, rather than the use of antiretroviral medication.
But despite the continuing death toll, there is a new optimism over the AIDS epidemic in South Africa. Hopes rest with the new health minister, who spent 8 years in prison for high treason under apartheid. Barbara Hogan was released with Nelson Mandela in 1990.
Well, you know, I have been extremely heartened. I have found South Africans from all walks of life just coming with support, saying, great, if there's anything we can do, I feel that there's an energy that's around. It's been, you know, the challenge is huge. You know, sometimes I wake up in the middle of the night and I say, you know, God, Barbara, what have you done? But the goodwill out there is extraordinary.
And I'm going to do your HIV test today. Okay.
With the arrival of Barbara Hogan and a fresh emphasis on HIV testing and prevention, the British government sees a real opportunity now to help get policies in place that might last. They're supporting the new programme with experts and cash.
This weekend I'm in South Africa to announce a £15 million programme to back the political courage of Barbara Hogan in tackling HIV/AIDS. It is frightening that 800 people every day die of HIV/AIDS. We want to ensure we back this new courageous leadership with a programme of rapid change. That programme will be about the biggest ever media campaign to shatter some of the myths around HIV/AIDS, getting to 90% of the South African population, tackling head-on the problem of pregnant women passing HIV on to their babies, improving the quality of healthcare systems in South Africa. And finally, we must make sure that this change is permanent, that never again will there be a political leadership in South Africa that is in denial about the scale of the problem.
And there's new hope in South Africa after a drug trial showed that early treatment of all children infected with HIV, even before they show symptoms, could save many thousands of lives, if only they can be identified in time.
Babies who were started on treatment immediately had a 4 times decreased chance of dying compared to those babies who were started on treatment just because they got symptoms or had poor immunity. The key thing that both for the South African government, Barbara Hogan, and other resource-limited settings will be to identify those babies.
So with modern medicine rising to the challenge, the question is whether Barbara Hogan can persuade senior politicians that science works before the presidential election next spring, when other voices might prevail.